Okay, guys, so this is Lawrence from Triumphant Lectures. So I just got something and I'd like to share it with you guys. It's so fun. So I want to talk about the Inguinal Canal. Most times people find it very difficult to understand the Inguinal Canal. Like, people find it difficult to know what is the wall, what are the walls, posterior, anterior, what is making up these walls, the superficial inguinal ring, the deep inguinal ring. When people read it, they find it very difficult. So today, it's fun. I just want to share my knowledge today. So I'm going to talk about the inguinal canal. So I'm going to make use of these two pieces of paper to explain what I want to explain. So we have this, just like a box. You have your box. Let's assume I place my box. Okay, so this is a box, right? You can see it, although I was not able to maybe attach it so that to not be off, to not be moving, shaking. So look, this is a box, right? And with this box now, we can be able to describe the inguinal canal. But before you will be able to understand what the inguinal canal is, you have to have idea, knowledge of the abdominal walls. We have the anterior abdominal wall and the lateral, that is the anterolateral abdominal wall, and the muscles there. You have to be aware of those things. We have the most superficial muscle, the external oblique muscle, then we have the internal oblique muscle and the transversus abdominis muscle, right? So look now, the first muscle, now let's assume this is the abdomen. You're looking at, this is a box, right? You're looking at an individual and he's standing erect. Are you getting it? First of all, in the abdomen, the abdominal region, this will be the two regions. This will be the right and the left. Are you getting it? So there are muscles here. The first one, the most superficial, as you already know, is the external oblique muscle, and that one is running. It's running in the direction of your hands in the pocket. It's running anterior inferiorly, also running anterior inferior. It's running from where? It's running from ribs 5-12 and then going to insert and form the inguinal ligament. It's inserting from the anterior and superior iliac spine to the pubic tubercle. Are you getting it? So now it's going to form a ligament. Again, and that's this ligament you're seeing now. That ligament now is just like it running this way, and to form a ligament. Ligament will be this inferior side, and then it will curve. You get like this. It will curve to form a curve. I get it to form a curve. That inguinal line. So when the external oblique muscle runs anterior inferiorly, it's going to form a curve after attaching to the anterior superior iliac spine and the pubic tubercle. Is going to then form a curve, and that's going to form the floor of the inguinal canal. Are you getting it? So the inguinal ligament is going to form the floor of the inguinal canal. So now we just talked about that. So for the anterior wall now, this inguinal canal is a canal, musculoparotid canal. Very important because there are some structures like the spermatic cord. Your testes, the male or gonads, they are outpouching of the abdominal wall. They consist of skin, they consist of the facial, they still consist of the muscles. So I get me. They're just outpouching of the anterior abdominal wall. So there are some important structures that will pass through this inguinal canal, like the spermatic cord in the male. Then we have what we call the round ligament in females. Then we have the ilio-inguinal nerve. It will pass through this inguinal canal. So now, having said that, this inguinal canal is divided into 4 walls. We have the anterior wall, which you are seeing, the posterior wall, which is facing me. We have the superior wall and the inferior wall. Then we have the medial area to the medial wall and the lateral wall. Are you getting it? So what will form the anterior wall is one. You know the external oblique muscle is coming down, it's running anterior inferiorly, and then forms a ligament that curves. Are you getting it? So the anterior wall is going to form be formed by the aponeurosis of the external oblique muscle. That's one point. It's going to be formed by what? The aponeurosis of the external oblique muscle. That's what's going to form the anterior wall. Not only that, you know that like for example, now look at this area now. You'll find the external oblique muscle, right? The aponeurosis of external oblique muscle. Then around the region of the iliac crest, you know that there's a muscle that is running superior anteriorly. It's running superior anteriorly. So that muscle, as you already know, is the what? Internal oblique muscle. So there are two structures that will form the anterior wall: the aponeurosis of the external oblique muscle and the internal oblique muscle, which is running superior anteriorly. That's for the anterior wall. Then now for the posterior wall, this internal oblique muscle is going to come, and you know also you have the transversus abdominis muscle, which is running along like transversely. So the internal oblique muscle and the transversus abdominis muscle, they are going to meet, and so when they meet at this edge, so the internal oblique muscle, the transversus abdominis muscle, they will meet at this edge. Then the transversus abdominis muscle will then form the superior wall of the inguinal canal. I get it. So that's what forms the superior wall, the transversus abdominis muscle. Then we've talked about the anterior and the superior wall. Now for the posterior wall, the structure that will form the posterior wall is, we have a tendon. When this transversus abdominis muscle runs to this region medially, to the medial end, there's a tendon that will be formed called the conjoint tendon. It will be formed. It will extend to the posterior wall, the medial part of the posterior wall, and also extend downwards, and then insert to the pubic symphysis. I get it. So the posterior wall, the medial aspect, you're not seeing it here. This posterior wall is going to be formed medially by the conjoint tendon. Then for the other part of it, the other part of the posterior wall is going to be formed by the transversalis fascia. So there are two structures that form the posterior wall: conjoint tendon and the transversalis fascia. That's for the anterior wall, superior wall, and the wall posterior. As we already said, the external oblique muscle is going to run anterior inferiorly, then form what? A ligament called the inguinal ligament. That inguinal ligament is going to form a curve downwards. I guess like a curve. So that's what's going to form the inferior wall. So we have talked about the anterior wall, which is formed by what? It's formed by the aponeurosis or external oblique muscle and the internal oblique muscle. Then we've talked about the superior wall, which is formed by transversus abdominis muscle. We talked about the posterior, which is formed by a tendon, one medially, the medial part of the posterior wall, which is formed by the conjoint tendon, and then the other part of it formed by the transversalis fascia. And this we have the medial and lateral. So these are the important structures. These are the important things I want to simplify for you guys. So within this region now, there's going to be an opening here, a ring. That's called the superficial inguinal ring. And that's where, and here too, you're seeing it here, right? Superficial inguinal, okay, yes, it's going to be the superficial inguinal ring. And then you have the deep inguinal ring. So the superficial inguinal ring is going to be on the aponeurosis of the external oblique muscle, while the deep inguinal ring is going to be on the posterior, that is it's going to be in an opening in the transversalis fascia. I get in it, transversalis fascia. So what will happen is, you know, the spermatic cord now is going to pass through this deep inguinal ring, that which is in the posterior, is going to pass through this deep inguinal ring, then goes through this inguinal ring, then goes through the canal, and then come out through the superficial inguinal ring. I get it. So that's the trick, and then it goes out and go into the what? Into the testis and form connection with the testis. Same thing applies to the ilio-inguinal nerve. So that's just what I want to share with you guys. So I believe you guys were able to understand. We talked about the anterior wall, posterior wall, superior wall, inferior wall, medial wall, and the lateral wall. So guys, I believe you guys understand. If you have any questions, you can like comment in the comment section below. So this is Lawrence from Triumphant Lectures. So I'm believing to see you guys in the next one. Thank you.